along with the United States Coast Guard. Finally, we chose locations with an on-site immunization health specialist. As Mr. McCaffrey noted, the good news is that our military medical teams have worked for months to prepare for this moment, and we're eager to begin to deliver on Operation Warp Speed's promise. The Department of Defense has decades of experience with conducting global vaccine programs, whether it's the annual flu campaigns or protection against novel diseases around the world. We vaccinate millions of our service members and families and retirees of every age every year. And we have systems in place to monitor the health of everyone who receives a vaccine. In terms of the next steps, following FDA approval, the department will receive and begin vaccinations of our high-priority populations this month. We've identified the military installations and the military treatment facilities that will receive the initial shipments of the approved vaccines, as Mr. McCaffrey noted. We've initiated our staff training protocols for vaccine administration and working closely with our TRICARE network providers and pharmacies to prepare for wider scale vaccinations as the vaccine supply expands. This phased approach to vaccination will take time. We recommend that everyone continue to follow the latest CDC guidelines to include physical distancing, hand washing, and wearing face coverings where appropriate. This has been a challenging year for all Americans, and I'm inspired by the perseverance and commitment of the men and women of the department and the military health system. Together, we're working as a team to protect all entrusted to our care. Thank you.
All right, thank you. We'll go to the phones. I don't know if Lita jumped on from AP. Lita? From AFP? All right, so we'll go into the room. Barbara.
I think my question is for the general. I wanted to ask on the medical side of this, sir. Could you explain as much as you can about what part of this vaccination program will be voluntary, what part will be mandatory? Just as much detail as you can, and especially for high priority categories, for deploying units, for senior leaders. Can you walk us through some of that?
Yes, ma'am. We anticipate that this will be approved using emergency use authorization, not a fully licensed FDA vaccination. And as such, the department's policy will be voluntary for everyone. So there's no ifs, ands, or buts about it. Doesn't matter. Voluntary for everyone.
So, I just don't know how this all works. So it starts with emergency use authorization. The vaccination is voluntary for everyone, including deploying units, including high priority units. Does it eventually in some way shift to mandatory once there's full FDA licensure? And how will that on a practical level work? For example, for special operations forces, small units, strategic units, deploying as on a team level if some people don't get it, don't take the vaccine?
Well, I don't know if Honorable McCaffrey wants to talk to the full licensure aspect and potential for future. The department is strongly encouraging everyone to take it. And the reason for that is you look at the data that are available to all of us now, that Pfizer, at least the one vendor, has made available to everyone. If you look at the safety profile of it, the safety profile is very good. And the efficacy of the vaccine, again, short time period, appears to be very good. So my advice as a physician is that if everything we do in life, every medication that we take, every surgical procedure that we have is all about risk. And the risk of this or these vaccines, from what we know, is much less than the risk of the actual disease process. So our advice to everyone, on a volunteer basis, our advice to everyone is to take the vaccine just based on risk.
Just quickly about making it mandatory.
So on that question, I think as General Pace indicated, this would be the normal process when a vaccine is first issued under emergency use authorization. It's typically on a voluntary basis, so we're going to be consistent with that. As it moves, as FDA looks at the experience of the vaccine, real experience that we're seeing in the population, and they ultimately, assuming they ultimately grant full licensure, at that point, the department would look at that and based upon, again, risks and benefits and look at unique requirements from the military departments, from the combatant commands, would make a determination if we believe for military readiness, we should consider, making a fully licensed COVID vaccine mandatory. But there's a process that we use based upon data, based upon the FDA's assessment. But I think the other question you raised was in this interim period where, not all the force is going to be vaccinated in the next month or two, the department's very clear in all of our policy, everything that we have in place right now in terms of our standard mandatory force health protection guidance in terms of public health mitigation, social distancing, testing before deployments, that will all continue. Even as we, in the early stages of the vaccination effort, we're going to continue all those measures. We have to, because not the entire force, both active duty and civilian, are going to be vaccinated. And then I think, as General Place indicated, part of our program in terms of communications is everything we can do to articulate to our people that we have great confidence in the FDA's rigor in making the determinations about efficacy and safety, and we are going to be, as part of our communication plan, using select key senior leaders to get the vaccination to demonstrate confidence in that. Much like recently Governor Hogan himself said, that's what he's going to do in terms of getting the vaccination out to the population of Maryland. He's going to demonstrate, yes, this is a safe and effective vaccine, and I'm encouraging everybody to take it.
All right, David.
Was your allocation based on the same per capita formula that the states were? And is that 44,000 going to be 44,000 shots in arms, or is it going to be 22,000 and hold 22,000 for the second shot? And one more question. Those locations up there, there's a lot of geography between all those locations. Are people going to have to come to those locations to get their shot, or are you going to distribute to sub-locations?
Yes, sir. Thanks for the question. So first, we have the same pro rata designation as all the other jurisdictions. So it's a small percentage, just like the states are receiving, the department received based on our population, a very, very small percentage, but it's equivalent to the other jurisdictions. In terms of your second question, the almost 44,000 is the initial dose. So one of the things in the process is you have to demonstrate all parts you have to receive, you have to administer, and you have to document before you can order the second dose. So this almost 44,000 is first dose. We contact back with the organization to get our second dose. And then for your third, no travel involved. This is a controlled pilot at these locations. This is to demonstrate that the process that we've developed actually works. Once we validated this controlled pilot, we have really scores of sites, hundreds of sites across the country and across the world that we have locations that vaccine will be sent to. So it's not, these are the only locations, everybody has to come to there, or these are the only locations. We take the vaccine from these locations to other outlying locations. This is just the first step in a controlled pilot.
So Dave, to your question on this is, if you look, there's 16 locations, our allocation is only 44,000. So the way that the vaccine goes out is in batches of 975 doses. So we have to have locations that have sufficient population to use all of that dosing there. And so that's why one of the criteria for the locations was a large population of prioritized personnel. And so if you look at the listing, you'll see some of our larger medical facilities, some of our larger joint base areas that will be receiving that because they have those populations there.
So 44,000 people at those locations.
Well, it's just the prioritized personnel.
Yeah.
So like in
4,000 people who qualify.
okay, yeah. So okay, all right.
General Lucas Tomlinson, Fox News. Is the reason the vaccine is voluntary because there's not enough to go around?
Yeah.
No, sir. It's voluntary because it's under an emergency use authorization. because the FDA is likely to determine, be careful about that, the FDA is likely to determine that not full licensure, but under emergency use authorization. And like every medication that we get in our facilities, emergency use authorization is different than full licensure, and we have to be able to communicate that to our patients when we talk about it. Because it's under the emergency use authorization, therefore voluntary.
Mr. McCaffrey, you mentioned that some reservists, some guardsmen, some spouses, some civilians, some contractors will be in part of this phased approach. How are you determining who is supposed to get the vaccine in those cases?
Can we actually go back a couple slides? I think there's the one that has the tiering. One more. I think that might be helpful.
The keyword was some. It wasn't like every dependent, every contractor. So I'm wondering what the...
Yeah, so basically eligibility we've defined in terms of dependents, select contractors, civilian employees, and it's going to be then how do they match up in terms of the prioritization tiers. We, like the rest of the country, the very, very top priority and initial phase is going to be healthcare workers. And so kind of first, those inpatient workers most close to the patient, the early emergency responders, public security, and then down in terms of outpatient and so forth. But it's going to be, are you eligible? And then where in that schema are you eligible? That's how you're going to get it.
Dependents, is that because they live with one of these people and so they should be getting a vaccine as well? One of these high priority cases?
So for dependents, it will be in the phase with regard to whether you are a high-risk beneficiary or the regular healthy population.
Okay, we're going to go back to the phones real quick. Sylvie?
Yeah. Okay, I'll just go. What is your target date for vaccinating the entire force?
Tom?
So the target date is going to be contingent upon, again, we're going to be getting an initial very limited quantity. We don't yet know how much quantity we're going to get then after that first week as additional vaccines in addition to Pfizer come out. So it's really going to be contingent upon how much vaccine, which types of vaccines we get over a period of time that we would be able to tell you based upon our schema. We expect we could do, X hundreds of thousands, by the end of January.